Hey, this is Roger. Roger, I'm actually rehabbing for a total knee replacement, but he came in today with this on his shoulder here, and I said, what happened? And he said, I can't reach behind my back, the front of my arm hurts, right? So go ahead and do that to about there. You want to stand up so we can see how far you can go back. Face that way, face that way. There we go. So they can see. There you go. So that's as far as it goes?
Yep.
Okay, and then go ahead and have a seat. So he gets to about, the SI joint before it stops him. And point to me where it hurts the most there.
Right in you.
Yeah, so it looks like he's got a little bicipital tendonitis going on there. He says it's flared up on him before. So what I'm going to do, normally if you watch these videos, what I do is I treat the ipsilateral side, but now I'm going to treat the contralateral side. The reason why I like to treat the ipsilateral side so much is because it's the maps are like in line with any other part of the body, whereas the maps on the contralateral side are a little bit skewed. So go ahead and put your arm behind your back and point to me exactly where again. And on a scale of 0 to 10, how would you rate that pain?
About a 4 if I don't reach any further back.
Okay, and then bring your arm forward. There you go. So what I'm going to do is I'm going to stimulate. On his quad here, quad tendon or quad that connects in there. Now this connects right here, but if you were to straighten this leg, go ahead and straighten this leg. Now that doesn't connect here anymore. It connects down in here. And if you were to like bend it, like all the way, like bend. Now it connects up in here. So the points change. This isn't like one point in the body connects to another point in the body all the time. It's not like that. When the fascia shifts, like the fascial suit shifts like this, the connection shifts. So the points are fluid. Let me get my bearing again. Go ahead and point to me exactly where again. Right there? Which finger? Right there? Okay. So I'm going to stimulate in here. And then go ahead and do it behind your back again. And he's got it all the way, now he's at like L4 now, so he's got a lot of range of motion. And I would say better, worse, or same. I always say better, worse, same to give him the opportunity to give me any one of those. If you say it's better, then a lot of times they say it's better. If you say it's worse, they might say it's worse. Better, worse, or same?
Much better.
Is it still there?
It still hurts, but it's much better.
All right, point to me where it hurts the most. Again. The reason why I say point to me where it hurts the most, and I always say that, is because he's pointing to a slightly different spot. So before he was down here and now he's up here. So that's a different spot to me here, okay? So there's two things I can do. I can straighten his leg more because the fascia will shift, or I can just move up on his leg more. Now go ahead and do it again behind your back. What about now?
Much better.
Much better?
It still hurts.
Okay, point to me with your fingertip exactly where.
It's moving over.
There you go.
This way.
Yeah, so now if you notice, he's pointing to a slightly different spot. So these are like off switches for pain on one particular millimeter of the body at a specific joint angle and angle of pressure. What I'm doing now is I'm shifting and I'm moving to another millimeter of the body. Like I'm moving over to his lateral shoulder a little bit more, or his long end of his bicep. It looks like he was pushing. So go ahead and do it again now. And in his range of motion, he's like up at like L1 now. So I'll show you after, but what about now? Right there? Yeah. So that's a different spot to me. I'm going to move down and over here. So usually you chase this around between 3 or 5 times. This is about 4 times right now, but usually 3 to 5 times it takes to knock it out, but we'll see here. And then go ahead and do it again. Wait. Right there. Okay, so I'm going to come a little bit more medial here. And what?
Wait.
And then go ahead and do it again. Oh, you have great range of motion now.
Yeah. I can put my belt in now. I couldn't put my belt in this morning.
There you go. What about now? Pain-wise. Is it still there?
It's still there, but it's much less.
What number would you give it?
2.
Okay, point to me with your fingertip exactly there. and there.
Wait,
So,
wait.
so if I try a bunch of times and I can't totally relieve it, what I do is I move to a different area of his body. And so what I'm going to do is I'm going to move over here to the ipsilateral side, and for whatever reason, we'll see what happens here. But no, go ahead, do it again for me. Way up now. He's up in his thoracic spine now. Much better range of motion.
Amazing.
Still there?
The pain's still there, but much less and much more range of motion.
And what number would you give it?
A 2.
And then point to me exactly where.
Right there.
Right there. So I'm gonna move.
Which is almost where we started.
Yeah, I'm gonna move more here to like his superior quad, the quad tendon, the superior knee, the quad tendon, and now go ahead and do it again.
Very dull pain now. Like
Is it pain, or would you call it a soreness?
a soreness?
Yeah.
Very
So
dull.
when I teach, what I say is there is a word, and I have a slide that says this slide right here will save you countless hours of debate over the course of your career. So he has full range of motion now. So go ahead and stand up, and then turn face that way away from me, and now put that arm behind your back. So he started here, if you remember. So that is a massive increase in range of motion, right? And I asked him, do you still have pain? And he said, it's like dull. And I said, would you call it sore? And because there's a word where people use, and not everybody uses the same word. They say it's dull, it's tight, it's weak, it's numb, it's hot. There's a word that everybody uses. But right now he has full range of motion, right? Put this one behind your back. And then the other one. So that's full range of motion, and he has, he says he wouldn't call it the word pain, it's like a soreness, okay? So at that point, he's done, he has full range of motion, and then that soreness will fade away. So, there you go.